Welcome everyone to this 7-day NCLEX Pharmacology live training day 2. If you're in nursing school or you're preparing for the NCLEX, this 7-day training is for you, as I will be discussing every day pharmacology NCLEX style questions. I will continue to show you the process of critical thinking and prioritization, and today's training is going to be extremely beneficial to you, as I will be sharing with you some pharmacology tips that you can use to do better on the NCLEX. So if you're ready to begin this journey, if you're ready to begin this day 2, go ahead and comment on the comment section, and let's talk about side effects versus adverse effects. So on the NCLEX, you will see questions that deals with side effect and adverse effect. And if you recall our first 7-day training that we did several months ago, 2 months ago, in one of the 7 days, I decided to dedicate that day for pharmacology, to cover an NCLEX category known as pharmacology, okay? Pharmacological and parenteral therapy. That is the category that the pharmacology questions appear on the NCLEX. Well, this day, this training, the 7-day pharmacology training, is an extension of that day that we covered pharmacological and parenteral therapies. And today, we're going to discuss some NCLEX pharmacology tips that will make your life much easier in order to select the correct response when you're dealing with an NCLEX question the day of your exam. Welcome to day 2 of our NCLEX Crusade International 7-day training. So let's start with the tips, the NCLEX tips. First tip that I want to share with you is an exercise that you can do to improve your knowledge of pharmacology. And although different students learn different ways, some students are more auditory, they learn more by listening than writing. Always writing is beneficial for you. So a tip that I think that is going to make a huge difference on your memorization, because remember, a lot of pharmacology deals with memory. The more you write, the better, the easier it is to recognize certain concepts. And I know that some students don't like writing. I am one of them. I hate writing. As a matter of fact, I see students that have like notebooks and notebooks and notebooks of written information, and I always ask them, when was the last time that you reviewed it? So if you're not going to review it, don't waste your time writing it. But in this scenario, you're going to create what is called medication or drug cards. And you could say, well, professor, I know that on Amazon, or I know this company that sells already made pharmacology cards. Why don't I just buy that and learn it? Well, that is a way that you can do it. But if you decide to write it yourself, it's going to be more beneficial. Now, I understand that it's going to take more time in order to make those cards. But remember, we're talking about what can you do to make it better. If you write it, the process of deciding, reading the information and saying, okay, I'm going to put this information here. No, this information is too long. I don't want to include that in the card. That's going to help you remember a lot of information. So this first tip, creating your medication card, it is beneficial for you to remember. I'm going to give you an example. Let's use digoxin as an example. Example number 1. Let's say you create a card that says digoxin. And on the back of the card, you can put the classification of this medication, which is a cardiac glycoside. You can put the medication is administered, or the patients that I will be administering this medication is for patients who have congestive heart failure or rapid atrial fibrillation or atrial fibrillation with a rapid ventricular response. The cardiac glycoside increases the contractility of the heart and decreases the heart rate. In heart failure, this medication is administered to increase the contractility of the heart, but in atrial fibrillation, the reason why the medication is administered is to decrease or slow the heart rate. Make sure every time you include information about a medication, include nursing interventions and drug-to-drug interactions. Why? Why this is important? Because many of the pharmacology NCLEX questions deal with nursing intervention. So yes, it is great to know the intended effect of the medication. It is great to know why you're giving the medication or their purpose for administering the medication. But most of the NCLEX style question deals with nursing interventions, identifying if the patient has a side effect, an adverse effect, and actions that you can do as a nurse whenever you see complications of medication administration. And other questions deal with prevention of complications once we decide to administer XYZ medication. Drug-to-drug interaction is extremely important. Also, if the patient is taking over-the-counter medication, the teaching behind the over-the-counter medication and how it can interact with a prescribed medication. A lot of questions on the NCLEX related to this, and also herbal remedies and how herbal remedies can interact with a prescribed medication. So anytime you're using a pharmacology book, you're using the Saunders, Pearson, Kaplan book, or whatever resource that you're using and you're studying pharmacology, make sure that you include nursing interventions and drug-to-drug interaction. Extremely important. This is an example of how the drug card can look. For example, on the front of the card, you can put the classification of the drug. You can put the action drug uses, nursing implication, and what are the important nursing interactions that you will be following for that specific category drug or medication. And then on the back of the card, you can include side effects, teaching needs, drug names, etc. So there are different ways that you can use this tip, making the pharmacology drug cards. You do something that works for you. Remember, things work differently for different students. I am just giving you some ideas to improve and have a higher chance to memorize and really learn pharmacology for your nursing school and also when you're preparing for the NCLEX. One way that I like to learn pharmacology is that I organize the medication by categories. Let's say, for example, that I want to study hypertensive medications or antihypertensive drugs. For example, many students like to put drugs together and they are disorganized. Remember that the more disorganized that you are, the worse it is to study pharmacology. Don't make it harder than what it already is. Pharmacology is very difficult, but if you're not organized, it's going to be worse. So if you're studying medications to treat hypertension, you know that there are several subcategories. For example, in the screen you have the angiotensin converting enzyme inhibitors or the ACE inhibitors. But you also have beta blockers. You also have calcium channel blockers. Remember that although they help with a patient with hypertension, they do not work the same way. The mechanism of action is different, and you have to know those mechanisms of action. Another tip that I can suggest is learn specific classifications of medication. including the mechanism of action, the side effect, and adverse effect. I will tell you this, okay? Unfortunately, I have seen many nursing books making a big mistake. And the mistake is that they put side effects and adverse effects together. They are similar, but are not the same. A side effect and an adverse effect is not the same thing. And you, as a nurse, you need to differentiate between side effects and adverse effects. As a matter of fact, you will see questions on the NCLEX that says, which of the following are side effects of XYZ medication? Which of the following are adverse effect of XYZ medication? So you need to know the difference. And when you're using different resources, sometimes they put it together and you don't know. So which one is a side effect? Which one is an adverse effect? In today's training, you will learn the exact difference between the intended effect, the side effect, and the adverse effect. Let's use, for example, a beta blocker, okay? You need to identify medications and the specific class that this medication represents. And also, you have to learn safety requirements that are related to that category. For example, when we're studying beta blockers, remember that it is an important safety nursing action to check the blood pressure and the apical pulse. Why? It is a safety measure. Why is that a safety measure? Because beta blockers will reduce the blood pressure, specifically the heart rate. So before you administer the medication, part of your assessment is to assess the blood pressure and to assess the apical pulse. But at the same time, if you're teaching a patient, you're doing discharge teaching about when the patient is going to take beta blocker medication at home, let's say metoprolol, we have to include in the teaching that the patient needs to check the blood pressure, but also check now the radial pulse, not the apical pulse, because as nurses, we check the apical pulse or apical pulse, but we teach the patient to check the radial pulse. So you see, this teaching is important. Whenever you see a specific teaching for a specific category or a specific medication that applies to that specific group, write it on your drug card, because this is going to be beneficial when you're answering pharmacology questions, whether it is a prioritization question or a select all that apply. A good change happened several years ago. Now, the NCLEX question will only include the generic name, not the brand name. I don't know how nursing students did it in the past, because in the past you had to know both the generic and brand name. What is the problem with that story? That there are numerous brand names for one generic name. Thanks God for the NCLEX now, all you have to learn are classifications and the specific generic names for each one of these drugs. And if you use prefix and suffixes, it will help you remember those categories. So if I were you, I would create a list of prefixes and suffixes that you can use to remember certain medications category. Now, the next tip that I want to include in this training is when you're analyzing a pharmacology question and any question in general, part of the 5 key factors of an NCLEX question is to determine who your patient is. Is your patient an adult? Is your patient a pediatric patient? Is your patient a female or a male? Is your patient pregnant? Is your patient breastfeeding? So who is your patient? And I want to dedicate or focus your attention on pediatric clients, pediatric patients. You need to be aware that medications affect differently a pediatric patient than an adult. It is known that when you are administering fluids to a pediatric patient, there are certain safety precautions that need to be taken in consideration. Why? Because a pediatric patient, in comparison to an adult patient, has a higher risk of fluid volume overload, and at the same time has a higher risk for dehydration. So when you're dealing with a pediatric patient, be specific on who your patient is and what is the medication that you are administering. For example, the weight of the child, the weight of the pediatric patient, it is used frequently to determine the dosage for the medication and whether it's going to be safe or unsafe. So part of pharmacology on the NCLEX deals with dosage calculation. And there is a video in our training on our YouTube channel where I teach you guys how to do dosage calculation with the dimensional analysis. If you haven't seen that video yet, make sure you find it here on our NCLEX Crusade International channel. I'm going to put a note here also so you can see it and find it later on. Well, dosage calculation, you're going to do a lot of dosage calculation maybe on your NCLEX to adult and pediatric patients. And remember that most of the medications for pediatric patients are prescribed in milligrams per kilogram. But the NCLEX makes it difficult, and they can give you the weight of the patient in pounds and not kilogram. So in those scenarios, you have to do a conversion factor, and you have to convert pounds to kilogram. Remember that 1 kilogram, it is equal to 2.2 pounds. An easy way to remember this is, if you're trying to lose weight, I love my weight in kilogram because it is smaller. I weigh more in pounds than in kilograms. Of course, it weighs the same. It's just a different measuring unit, but it's just for you to memorize that 1 kilogram, a smaller number, equals 2.2 pounds, a bigger number. All right? So there could be questions on pharmacology for pediatric patients where you have to identify if that is a safe dose or not. They might give you a therapeutic range, and you have to identify if the dosage that you have in front of you is in the therapeutic range of that specific medication for that specific patient. When we talked about elderly clients, similar concept. Elderly clients are also a higher risk for drug toxicity, adverse effect. As you know, the body has aged, the different organs are not working as perfect as it was working before. The patient can develop hepatotoxicity and nephrotoxicity sooner depending on the medication. Also remember that a lot of the elderly patients have polypharmacals, meaning that they take a lot of medications usually at the same time, and there's always that risk of medication to medication interaction. So the nurse needs to be aware of how the elderly client can have a higher risk for safety, higher risk of toxicity, higher risk of falls. So a lot of that critical thinking for the NCLEX. Remember that you have to identify that certain laboratories needs to be monitored. For example, if we're giving the patient certain diuretics, we have to monitor for electrolyte imbalance and so on. The elderly patient, it is a very a client that you need to be very, very careful. The extremes, elderly or the pediatric patients, specifically the newborns and the infants. The infants is very important. A lot of questions about infants, okay? And then lastly, I wanted to share about pharmacology and female patients, okay? Female patients that are either pregnant in the first, second, or third trimester, female patients that are breastfeeding. Whenever you see on an NCLEX question, here we have a female client that is primipara or primigravida, is telling you that this female is in the second trimester or third trimester or first trimester, you have to recognize, why is it telling me that this patient is pregnant and in the first, second, or third trimester? Remember that some medications are teratogenic, meaning that it can cause damage to the fetus, harm to the fetus. So whenever you see medication and pregnancy, is usually the question is related to an effect of the medication and the harm that it could do to the developing fetus. The same way with a mother that is breastfeeding. You see breastfeeding, you see a medication, think, what is the safety problem here? What is the interaction between the medication and the female that is breastfeeding? Keep that as an important factor to determine, okay? Let's talk about pharmacology and teaching, because as I mentioned before, a lot of the pharmacology questions on the NCLEX deals with teaching. All nursing care, or most of the NCLEX style questions, are directed towards promoting, maintaining, and restoring health and preventing illness, and also helping people adapt to the residual effects of illness. In other words, there is a category on the NCLEX that is called health promotion and maintenance. There is a specific category for that. So a lot of the questions on teaching on the NCLEX and pharmacology deals with promoting or preventing. This is why part of the teaching that we include to the patients and family, you have to monitor for side effects. You have to monitor for adverse effects. If you see this happening, you have to call the doctor. If you see this happening, no need to call the doctor. It's an expected side effect of the medication. So a lot of questions on the NCLEX deals with this. So learn what is asking on the stem of the question, because many of the nursing activities, okay, or answers on the NCLEX deals with patient education. One of the goals of patient education is to encourage the patient to adhere, to follow a therapeutic regimen. What is one of the problems that we see very frequently with patients and medications? That they don't follow the regimen. They don't adhere or follow the therapeutic regimen. And there are some medications that if the patient doesn't take it exactly as it is prescribed, is going to affect the therapeutic range of the medication. The medication is not going to fall within the therapeutic range. It could be either subtherapeutic or in a toxicity level. So a lot of the question on the NCLEX deals with asking question and validating whether the patient is following the regimen or the exact physician order for that specific medication. So do not assume that all the questions are always going to be about the intended effect or side effect or adverse effect of a medication. It could be as simple as asking a question and validating when the patient is taking XYZ medication. Are you taking a medication in the morning? Are you taking a medication at night? How is the patient following the regimen, therapeutic regimen of that prescription? Now, there are a lot of scenarios that could cause a patient to not follow the order of the doctor. There's a wide range of variables influencing the degree of adherence for that specific medication. And I want to discuss some of these variables. One, demographic variables. What do I mean? What do you mean, Professor Ray? Demographic variables, meaning age, gender, race, socioeconomic status, and level of education. And you may ask, well, what does age, gender, race, socioeconomic status, and level of education has to do with medication adherence? What is the relationship? Well, very simple. If the level of education of the patient is lower, the patient may not understand the instructions that the doctor gave to the patient. The patient may not understand the importance of following the medication regimen. What does age have to do with medication adherence? Well, if you have an elderly patient, the elderly patient can be confused, can be forgetful, forget to take the medications. How many times we see the elderly population overdosing on medication? Because they forgot to take one dose and they assume, oh, I forgot the morning dose, let me take 2 doses back to back. Or actually, I forgot yesterday and the day before yesterday's dose, and today I'm going to take all the doses that I missed for the past 2 days. What happens? Medication overdose. So age is an extremely important factor to determine if a patient is going to or not going to follow the medication regimen or adherence of the medication instructions or pharmacology instructions from the doctor. Another factor is illness variable, such as the severity of the illness and the relief of the symptoms afforded by the therapy. In other words, let's say you're dealing with a patient that has a chronic condition, and doesn't matter how the patient takes the medication, the patient sees that he's taking the medication for a long period of time, and the symptoms not necessarily improve. The patient continues to deteriorate. There could be a time that they go, enough is enough. I'm not taking any more medication. So that is what is called an illness variable. Another variable is therapeutic regimen variables, such as the complexity of the treatment itself, fatigue, or important one, uncomfortable side effects. So a lot of times we see that patients don't take medications and we think that they're just being stubborn. They're just not following the regimen because they are being difficult. But sometimes they cannot deal with the uncomfortable side effect, common side effects that could be experiencing from taking those medications. So it is important to teach the patient about the side effects that they could be experiencing, because they might think, oh, if I get dizzy, then that means that something is bad with the medication. No, we have to teach that sometimes dizziness could be an expected side effect of the medication. Another factor is psychosocial variables: intelligence, motivation, availability of significant others, support from other people, family members, attitude towards healthcare professional, acceptance or denial of illness, substance abuse, religious or cultural beliefs. Some cultures don't believe in pain medication. They think that if they take a pain medication, they're being evil. So we have to understand how these psychosocial factors or variable could influence on a patient following or not following a specific medication protocol. And lastly, financial variable. Sometimes the cost of the medication is too much and the patient does not have enough money to pay for that medication. Well, maybe the patient needs some social help. Maybe we gotta get the case manager or social worker involved to find some assistance for payments for the medication. So I wanted to start this day 2 of the 7-day pharmacology training with some tips in pharmacology teaching. Now, guys, don't think that this teaching I have dedicated about 15 minutes or 20 minutes to waste anybody's time. you can see everything that I just mentioned on select all that apply style of questions. So I encourage that you go back to this part of the video and really take notes and learn everything that I have included with pharmacology and the teaching, because I guarantee you, you will see it on a select all that apply pharmacology question on your NCLEX. This is a resume of everything that I have found so far on different books that will help you learn about teaching and pharmacology. So do not take it for granted. Go back and review it. The next part of this training, I want you to learn the difference between intended effect, side effect, and adverse effect. What is the difference, Professor, between intended side effect and adverse effect? The intended effect, it is the reason of why we give a medication. In other words, the questions that you're going to see on the NCLEX is about finding information on the answers that describe that certain signs and symptoms improve. So this is a huge tip for you. Whenever you see a question that states, which of the following patient response describe that the medication is effective? In those scenarios, in 99.9% of the time, they will tell you some kind of symptom on the stem of the question. They may give you a neurological symptom. They may give you a cardiovascular symptom. They may give you a respiratory symptom. So whenever they give you clinical manifestations on the stem of the question, and then it says, which of the following patients' response indicates that the treatment is effective, find an answer that tells you that the problem in the stem of the question is better. In other words, another question could be, which is an appropriate nursing action to determine if the medication regimen is effective? That is another style of question, but it works the same way. Find an assessment that validates the patient's condition that was described on the stem of the question. If you're watching this later on, you need to pause and go back and listen to what I just mentioned, because this is an excellent tip to answer questions that deals with when a medication is effective. Okay? So go back and review it again. Let me give you an example. If an antibiotic is being administered to a client with an infection caused by an agent sensitive to that specific antibiotic, then what will be a response from the patient that indicates that the medication regimen was effective? Well, very simple. If the patient had a condition, an infection, and we gave an antibiotic to treat that specific bacterium, then we know that we're going to start seeing some changes in the white blood cell count. So do you think it will be an important assessment to check the CBC and check the white blood count levels? Do you think that's an accurate assessment to do to validate if the patient's medication was effective for that condition? So if the patient is telling you, in another example, let's say the patient has a neurological condition like increased intracranial pressure and is receiving mannitol. Remember the question that we did yesterday? The patient receiving mannitol, or I think we covered on the previous 7-day training. There was a scenario that a patient had increased intracranial pressure and was receiving mannitol, that osmotic diuretic. And basically, he said, well, which of the following nursing action would be appropriate to determine if the medication was effective? And what was the answer? The answer was to assess the neurological status. What are we saying, guys? What did I just mention? They gave you a problem on the stem of the question. Increased intracranial pressure. What is that? A neurological problem. What is an answer that I'm looking for to tell me if the regimen, if the medication was effective? Well, check for mental status. Check for neurological response. Because we have a neurological problem, I need to do an assessment in the neurological system in order to identify if the medication was effective. I hope you understand what I'm trying to say. If it makes sense to you, comment on the comment section. Yes, professor, it makes total sense. Another example, let's say you're giving furosemide or you're giving digoxin for a patient with heart failure. And he's telling you that the patient came to the ER with difficulty breathing. The patient has a history of congestive heart failure, and the patient is receiving the medication of furosemide or digoxin. Furosemide, the diuretic, or digoxin, the cardiac glycoside. And he says, which of the following nursing action is appropriate to identify the effectiveness of the medication, or to identify if the medication was effective? So what would be an appropriate response? Assess for lung sounds. Why is that a good answer? Because I am doing an assessment on the lung sounds, and it told me on the stem of the patient that the patient had difficulty breathing. So now this assessment validates the respiratory status, and it will tell me if the medication is being effective or not. So that is an intended effect. So anytime you see a question that deals with intended effect or the effectiveness of the medication, or if a medication is effective, this is the rationale or the thinking that you will be following. Give it a shot. If you have a QBank and you're practicing pharmacology question, try these tips that I have included in today's training, and you will see how your answers and your scores will continue to improve. Let's go to side effect. What is a side effect? A side effect is a physiological effect of a medication that is unrelated, not related to the reason of why we're giving the medication. An example, we're giving to a patient an antihistamine, and the patient starts experiencing drowsiness. Well, we're not giving an antihistamine to cause drowsiness. The drowsiness, it is a side effect of the medication. But I'll give you this tip. I'll give you this tip, write it down. Because this is what's going to make the difference between a side effect and adverse effect, and books does not describe it necessarily. Okay? So a side effect is an undesired effect, unrelated effect to the intended effect of the medication, but it is usually non-life-threatening. Okay? It is usually non-life-threatening. And it can be alleviated rather easy without further medical intervention. Okay? So, hear me out. A side effect is an undesired effect. We don't want that effect, but it happens. But that effect or that side effect, it is non-life-threatening. So the patient is not going to die from that side effect. And usually can be treated without the patient having to go back to the doctor or having to go back to the emergency room to be treated. So if you see a question that deals with which of the following are side effects of XYZ medication, you're going to think, okay, side effect is an undesired effect but does not cause a life-threatening situation. So whenever you see answer that says severe, the patient is not breathing, the patient is falling, things that can cause a lot of harm for the patient, you're going to eliminate, because that's not a side effect. That is an adverse effect. So if you understand this example, you're going to understand what a side effect is. Let me give you another scenario. Let's say you're dealing with a patient with pain and you're giving, let's say, an opioid medication. Well, the intended effect of why we're giving that pain medication is to relieve the pain. But what is a side effect that the patient can experience? Constipation. Does the patient need to go quickly back to the emergency room for that constipation? No. Usually with a high fiber diet, more fluid intake, we can deal with the side effects of that pain medication. So that is how you know the difference between side effect and adverse effect. But what is an adverse effect? How do I know what is an adverse effect of the medication? Remember that an adverse effect, it is also an undesired effect. We don't want that effect either, but this one can be and usually is life-threatening. And here's the key. The doctor needs to be notified because it is not treated easily. Oh, let me just drink water and I will take care of this. No, not an adverse effect. An adverse effect is a life-threatening condition. If you do not act fast, the patient can and will die. What is an example of an adverse effect? Agranulocytosis, bone marrow suppression. That's an example of an adverse effect. An anaphylactic reaction to an antibiotic. That is an adverse effect. If you don't deal with this bone marrow suppression, if you're not dealing fast with a respiratory problem from an anaphylactic reaction, your patient will die. So that is the difference between side effect and adverse effect. They're both an undesired effect, but one is usually non-life-threatening, can be fixed rather easy, and the other one is life-threatening and needs medical intervention in order to be treated. That is the difference. Okay? For the remainder of today's day 2 of our Pharmacology NCLEX 7-day training, I want to practice some questions with you. I always like to practice questions. Why? Why, Professor? Why is practicing questions so important? Because by practicing questions, you will apply the knowledge that you just received. If you don't practice questions, the knowledge will stay there somewhere in your back of your mind that you will probably lose if you don't use it. I see practicing questions, guys, like riding a bicycle. Okay? Would you agree with me? And comment on the comment section if you agree. Would you agree with me that you can be a very smart individual, very knowledgeable? You have studied a whole book on what is the proper way to ride a bicycle. And you get in front of the bicycle. You get on the bicycle, and as soon as you start pedaling, you fall down. You fail. And you say, but how come? I'm so smart. I read a whole book that taught me how to ride a bicycle. And I jumped on the bicycle, I fell, and I hurt myself. What happened? That is exactly what happens with the NCLEX. Maybe you read the Saunders book completely from beginning to end. Maybe you have read numerous nursing books from beginning to end, and you consider yourself a smart individual, but you go to the NCLEX and fail. And you say, why? I'm so smart. I read the whole book. Why did I fail? Simple. You did not practice enough. You did not jump on the bicycle and start pedaling. Fall down, get up, continue pedaling. Fall down again, get up, continue pedaling. Fall down again, get up, continue pedaling. That is what a Q bank gives you the opportunity to do. You're going to answer questions wrong. You're gonna get low scores. Doesn't matter. Keep practicing. You will get better. So I believe, this is my perception, this is my belief. Maybe other people don't believe what I believe. But I believe that without practicing questions, you will not master the ability to develop your critical thinking, which, as we talked yesterday, it is extremely necessary to pass the NCLEX. So how are you going to get better? Practice questions. The more you practice, the better you will get. So if you're ready to practice questions on some of the things that we have discussed today, let's do it. So if you want to practice, comment on the comment section. I am ready to see the first question. If you haven't subscribed to our channel yet, make sure you do it. Find that subscription button somewhere on our channel. It is free. Under the video, you will see a link that says subscribe. Make sure you hit that link, hit that button, the subscription button, and activate the bell. If you don't activate the bell, you will not get notification, and you will miss a lot of information. You will miss other days of the live training. Sometimes I see, Professor, I forgot that the training was today at 5. If you click on that notification bell, YouTube will notify you. You will get a notification on your cell phone. Okay? So find the subscription, click subscribe, and activate the bell. And also, of course, find the like button on this day 2 video. Hit it so you can help me grow my channel. Right now, there are about 280 likes on this video, and we have 738 live students right now. So please, that will be the way to help me. I am helping you. Help me. Okay? Help this channel grow so I can continue providing this free training, beneficial free training for you guys. Okay? All right. Once everybody has done that, if you desire, you can join our Telegram group for the same reason. Just to be notified, I put on the top of the comment section in the description a link for our Telegram group. If you want to join that group to stay in touch with us, it is a group, not a chat. So you cannot chat in there. It's just to receive a notification. All right? So let's go with the first question. Okay? Let's go with the first question, and let's apply the tips and strategy that I just mentioned. Okay? All right. Let's begin with the first one. Thanks to everyone that have decided to support our channel. I don't want to forget. Thank you for doing that for us. It's not necessary, but I appreciate the ones that have dedicated the time to support our channel. Thank you for that. So this question states, the client diagnosed with migraine headaches that occurs every 2 to 3 days is placed on preventive therapy with propranolol. Okay? So they're giving propranolol as a preventive therapy. Okay? Prophylaxis. Which data indicates the medication is effective. So here we see this keyword. We're looking for an answer that tells me that the patient is better. What do you think is the answer? Comment on the comment section your answer, but do something else. Tell me why. So put your answer and comment why. If you're watching it live now, do it. If you're watching it on the recording version, it's fine. Comment also, so I can see the thinking behind your answer. 1, the client has had one headache episode in the past week. 2, the client's apical pulse is 58 beats per minute. 3, the client has developed orthostatic hypotension. 4, the client supplemented propranolol with sumatriptan 4 times. What an interesting scenario. So if you review the stem of the question, it tells you that the headaches, the migraine headaches, occurs every 2 to 3 days. So let's go with every 2 days. You know that there are 7 days in a week. So if it happened every 2 days, the patient experienced at least 3 episodes of migraine headaches that week. If happened every 3 days, the patient experienced at least 2 that week. And look what answer number 1 says. The client has had 1 headache episode in the past week. A week is 7 days. So 1 headache, 7 days. Is there an improvement between the stem of the question and the answer? Yes, there is an improvement. What was the problem on the stem of the question? Headaches. The frequency of the headaches. Which answer deals with the same problem and shows an improvement? Answer number 1. And you may say, oh, professor, this is too easy. This is very simple. But use the same concept on other questions, on harder questions. I want you to learn concept, not an answer. What is the concept behind this scenario? That you discover that there was a problem on the stem of the question that was headache, and there is an answer that doesn't say the headache is better, but it has fewer episodes of migraine headaches. So since the episodes reduce, that indicates an improvement. Now, do you really need to know the mechanism of action or category of propranolol to answer this question? No, because I am looking for symptoms that shows improvement. I can see improvement in other areas, but if it does not relate to the problem on the stem of the question, then it's not the answer. Look at answer number 1. The apical pulse is 58. Well, we have a little bit of bradycardia here because the range, the normal range, is 60 to 100. So 58 shows bradycardia. Why the bradycardia? Well, you know that propranolol, Inderol, the other name, is a beta blocker, and a beta blocker slows the conduction of the heart, the atrioventricular conduction, and it will decrease hopefully if it's effective, the heart rate of the heart. So it can cause bradycardia. And you may ask, well, Professor, but a quick question. What is the relationship with propranolol and migraine headaches? Because I can see propranolol being administered for tachycardia, but why migraine headaches? What's the relationship between? Well, propranolol, it is very effective as a prophylactic medication to prevent migraine headaches because of the effect of reducing blood vessel dilation, which is known to contribute for migraine headaches. And it also decreases the excitability of the nervous system. So it helps a little bit with that as well. It is the most common and most effective first line of medication as a prophylactic medication to treat migraine headaches. So an important knowledge or concept to learn in regards to propranolol and migraine headaches. So answer number 2, we know that answer number 2, the decrease in the heart rate, it is the effect of the medication, but it's not the reason why it was given on the stem of the question. Because you could say, oh, that's awesome. The heart rate decrease, that is the effect of a beta blocker. Yes, but it's not the reason why it was given on the stem of the question. It is not the problem on the stem of the question because the patient doesn't have tachycardia. The reason why we're giving propranolol is not to treat tachycardia, is to treat the migraine headaches as a prophylactic medication. So answer number 2, I can eliminate. Answer number 3, the client has developed orthostatic hypotension. Well, we know that the blood pressure can also decrease, okay? It affects more the heart rate, but the blood pressure can also decrease. And the patient can have hypotension or low blood pressure when the patient stands up. So this does not show any improvement and has no correlationship with the reason of why the propranolol was given on the stem of the question. So answer number 3 is eliminated. And answer number 4. I love answer number 4. Answer number 4 says, the client supplemented propranolol with sumatriptan 4 times a day. I see some of you commenting on the comment section the effects of propranolol, okay? Remember that propranolol is a beta blocker, and some beta blockers are specific, okay, or non-specific, or selective or non-selective. Some affect the beta 1 receptors, and some affect the beta 2 receptors, okay? So I will not go into in-depth about that because I will be going outside the scope of this training. But I understand the comments that you're putting in the comment section, okay? But nonetheless, answer number 2 and answer number 3 are eliminated because it does not relate to the reason of why we are giving propranolol in this scenario, okay? Answer number 4, read the answer. It says, the client supplemented propranolol with another medication which is called sumatriptan. And I ask you, when does a patient need to supplement a medication? When does a patient need to use another medication to supplement one medication that has been prescribed? When the medication is not being effective. So sumatriptan, it is used to treat the symptoms of migraine headaches. But if it had to be given on top of the propranolol, it means that it did not get better. If it got better with propranolol, no need to use another medication. So answer number 4, we can eliminate. The correct answer is number 1. Okay? Excellent. Let's go to the next question. The next question, I will give you what is called an exhibit. An exhibit, you have to interpret the exhibit. And in this scenario, the exhibit is an electrocardiogram strip. A 6-second electrocardiogram strip. How do I know, or how do you know it's a 6-second? Well, you have to count the amount of big squares. You have to have 30 big squares in order to identify that you have a 6-second strip. If the nurses here are having a lot of difficulty on EKG interpretation inside our membership, which many of you are already members of the membership, there are a class there, an EKG class that will teach you how to interpret an EKG. Very simple. You will learn how to identify EKG strips and learn how to answer these type of questions. So it says the client reports weakness, dizziness, lightheadedness, and is exhibiting the following telemetry strip. The nurse administered the atropine sulfate intravenously, which data best describe or best indicates the medication was effective. So in order to answer this question, you have to interpret the EKG strip. In this scenario, we know that the heart rate is about 50 beats per minute. How do I know that? Well, there are 2 methods to interpreting an EKG. And whichever 2 methods you use, the heart rate is going to be below 60, which indicates that this is a strip that shows sinus bradycardia. How do I know that it is sinus bradycardia? Well, there's a P wave for every QRS. The PR interval is normal. It is regular. So this is sinus bradycardia. The heart rate is below 60. So if I know that this is sinus bradycardia, which answer tells me that the medication atropine was effective? Well, you know that atropine can be given to increase the heart rate. Okay? Atropine is also given in other conditions. But let's skip to this scenario. So if the patient has sinus bradycardia, how do I know that it got better? Look at answer number 1. The client's apical pulse rate is 68. No more bradycardia. Now it went back to the normal range, 60 to 100. So answer number 1 tells me that the patient is better. Once again, what was the problem on the stem of the question? Symptomatic sinus bradycardia. Dizziness, weakness, lightheadedness, but also bradycardia, accordingly to the strip. So what is the problem? Bradycardia. Which answer shows that the patient got better, improved, the medication was effective, increase in the heart rate? So the strip shows decreased heart rate. Answer number 1 shows improvement of the heart rate. I like this answer. Remember, I'm not putting very difficult questions because I want you to learn the concept. Problem discovered, bradycardia. Which answer shows an improvement to the problem? Increase in heart rate. Answer number 1 sounds like a great answer. Answer number 2, the client's blood pressure is 110/70. There is no objective description of the blood pressure on the stem of the question. So by answer number 2, I cannot identify if it improved. Plus, atropine has very low effect on the blood pressure. Okay, so answer number 2, eliminated. The client's oral mucosa is moist. Okay, this does not make sense. Okay, the side effect that we usually see with atropine is dry mouth, not moist oral mucosa. So answer number 3, I can eliminate for content, and also does that indicate any improvement in the bradycardia? No. So answer number 3, eliminated. Answer number 4, the client ambulates to the bathroom safely. And yes, there is an important word here on answer number 4. Safety is extremely important, but also remember this. If a patient is experiencing weakness, dizziness, and lightheadedness, unless we have already validated that the patient is better, the patient shouldn't be walking. But even though, let's say that the patient is better, is able to walk to the bathroom safely, it does not indicate any improvement on the stem of the question, which was bradycardia. Answer number 4, eliminated. The correct answer is number 1. Once again, learn concepts, application of critical thinking. Now, there are going to be questions that are harder. Do the same thing. What is the problem on the stem of the question? Neurological. Find an answer that is a neurological response and shows improvement. Do not go find pain answer, because that's not the focus of the question. Find the problem, find an answer that deals with that problem and shows an improvement. That is the key. That is the critical thinking behind this practice exercises that we're doing. Family, I am showing you quality critical thinking strategies. Okay? Here, free on YouTube. Do not take this YouTube channel for granted. Okay? I am here to help you improve. I am here to help you pass your NCLEX. I don't need you to pay me $3,000 in order to teach you. I love teaching. That is why I created this channel. And it's going to grow. I know that. It will grow tremendously. In 3-4 months, the channel already has more than 20,000 subscribers. And I haven't done anything. The only thing that I've done is sit here and help you guys. Okay? So I know that it will grow. But use it accordingly. How do you use this channel accordingly? You watch the videos over and over and over and over until this becomes second nature. The videos on this channel are not videos that you see once and you move to the next. This is not an entertainment channel. This is not a channel to make you laugh. Although maybe I say a joke and make you laugh. But I'm not a very joke guy. I don't make a lot of jokes, okay? But use it properly. If you use it properly, it will help you pass your NCLEX, okay? If you want to use the membership and learn, great. If not, it's okay too. If you want to join sometimes the live classes that we do to help you improve, great. If not, it is okay too. But use it accordingly. It's the only thing that I ask. Let's go to the next question. Which side effects? So now we're going to a different question. The question before was about the effectiveness of a treatment, the effectiveness of a medication. Now it says side effect. Okay, which side effect should the nurse explain to the male client? We're talking about teaching here. Who is prescribed cimetidine. Okay? So this question deals with teaching, and it has to do with side effects. So what teaching I can give to my patient about the side effects of cimetidine? Answer number one, the medication can cause indigestion and heartburn. The medication can cause impotence and gynecomastia. The medication can cause insomnia and hypervigilance. And the medication can cause Zollinger-Ellison's syndrome. See, this question is a little bit more difficult. And as I can see on the answers, I see some of you putting answer number one, some of you putting answer number 2, 3, and 4. So if you're watching this video, record it. What is your answer and why? So I'm looking for a side effect of cimetidine. You see, in this scenario, you have to know what cimetidine is. Okay? You see, the previous scenario, you could answer the question even without knowing the specific medication. But now, you really have to understand the medication itself. Okay? All right, I see one of my advisors is putting something there on the comment section. Be careful with the people with no moral values that are commenting, go to this link to go to like a pornographic site or stuff like that. I don't believe in that, guys. For me, that's immoral. And my advisors, please be very aware of this and remove any of those comments on the comment section, okay? Thank you. So you need to know the medication that they're telling you here, the effect, the intended effect of the medication, the side effect, and the adverse effect that could be experienced in this scenario, okay? So answer number one says, and I saw some of you selecting answer number one, so I tell you why answer number one is not the answer, okay? Some of you selected the medication can cause indigestion and heartburn. Well, the first thing that we gotta know, what is cimetidine? Cimetidine is an H2 receptor blocker. It is used to treat indigestion and heartburn. So answer number one does not make sense because I give this medication to treat exactly that problem, indigestion and heartburn. Okay? But also, think about of the side effect, intended effect, adverse effect description that I gave you earlier during the class. Answer number two, the medication causes impotence and gynecomastia. So answer number two, the first thing that you have to know that cimetidine can cause impotence and gynecomastia over time. It is over time. The more the patient takes this medication, the longer it takes this medication, the higher the risk of developing the impotence and gynecomastia. So if it's something that happens over time, we're not talking about an adverse effect. Okay? Remember, adverse effect, acute, something rather quickly, life-threatening condition. Is impotence and gynecomastia, is that a life-threatening condition? No. So side effect and answer number two makes sense because impotence and gynecomastia or gynecomastia, it is a side effect, an undesired effect, but doesn't bring a life-threatening situation. So answer number one was eliminated because that is the reason of why I give cimetidine. Answer number two is a possible answer because impotence and gynecomastia are side effects that could be seen when the patient takes the medication over time. Answer number three, the medication can cause insomnia and hypervigilance. It's completely the opposite. The patient can experience lethargy, and somnolence. Okay, so answer number 3 does not make sense. Answer number 4, the medication can cause Zollinger-Ellison's syndrome. Maybe some of you don't recognize what this is. Zollinger-Ellison syndrome is a rare condition that causes different problems, tumors to form in the pancreas, upper parts of the small intestine, and the patient can develop a situation where large amount of a hormone called gastrin, which causes a higher production of acid, hydrochloric acid. So the Zollinger-Ellison syndrome can manifest a scenario where too much acid is being produced and the patient may need cimetidine to treat the symptoms seen in Zollinger-Ellison syndrome. So answer number 4 is eliminated because it is not a side effect of cimetidine. The correct answer is answer number 2. Okay? Let's go to the next scenario. The 8-year-old child diagnosed with gastroenteritis is admitted to the pediatric unit. Okay? Important keyword here. We're dealing with a pediatric patient. It's an 8-year-old child. Whenever they give you, whenever they give you the age of the child, the age of your patient is important. Child, 8 years old. What is the child's problem? What is the child's diagnosis? Gastroenteritis. And the patient is admitted to the unit. The nurse administered prochlorperazine rectally. Which adverse effect should the nurse assess for? So now you see that the question is completely different. Now we're not talking about intended effect. Now we're not talking about side effect. Now we're talking about adverse effect. So automatically you have to go, okay, adverse effect is an undesired effect that causes a life-threatening condition and cannot be treated easily. It needs medical intervention. So, nausea, vomiting, and diarrhea, answer number 1. Tremors, involuntary twitching, and restlessness. Diplopia, ptosis, and urinary retention. And answer number 4, dry mouth and constipation. So I see some of you selecting answer number 2. I see some of you selecting answer number 4. So what is the correct answer and why? So if you selected answer number 2, why? What was the reason behind your selection? If you selected answer number 4, why did you select answer number 4? And know this trick, this strategy. Whenever you are in between two answers, write it down. And when you find the answer, the correct answer, identify if you selected the correct or the incorrect and how often that happens. You're going to see that at the beginning of your training, more frequently you will select the incorrect answer. But as your critical thinking begins to improve, you will jump into the selecting the correct answer more frequently. That's how you know your critical thinking is improving. So, what is an adverse effect of this medication? Now, what is this medication? This medication is an antiemetic drug. It's a medication for nausea and vomiting. This medication, okay, they're an important situation that you need to write down whenever you give this medication that I will discuss. So if we look at the answers, which answer you can eliminate very quickly? Which answer you can say, definitely, this is not the correct answer because it is not an adverse effect. So do you see any answer that it is a side effect of the medication? Do you see an answer that is a side effect of the medication? Which one? Remember that this medication, okay, the prochlorperazine, some of these medications are so hard to pronounce. This is a dopamine antagonist, okay, phenothiazines. So what is the side effects that you can see? The first thing that you can do to eliminate answer number 4 is dry mouth and constipation is a side effect seen on many medications. But I'm not looking for a side effect. I am looking for an adverse effect, a life-threatening condition. So answer number 4 is eliminated. We have answer 1, answer 2, and answer 3. Number 1 says nausea, vomiting, and diarrhea. Why is answer number 1 not the correct answer? Because it's not. This is not the correct answer. But why? The reason that you need to be commenting on the comment section. Why you think 1 is not the answer if you selected answer number 2 or 3 or another answer. Why did you eliminate answer number 1? Well, if I'm giving this medication for gastroenteritis, I am giving it to relieve, to improve nausea and vomiting. So how come I'm going to give a medication to treat the symptoms of gastroenteritis and it's going to give me the same symptoms that I am treating? So answer number 1 is the reason to give this medication, compazine or prochlorperazine. Nausea, vomiting, and diarrhea. Okay? Now, this medication is not known to cause diarrhea, so this does not make sense. So 2 reasons why I can eliminate answer number 1. Does not make sense with diarrhea, and I am giving it to treat the nausea and vomiting. Because the medication that I am giving is an antiemetic drug to treat the nausea and vomiting. So 1 is gone. We have 2 and 3. Tremors, involuntary twitching and restlessness, and 3, diplopia, ptosis, and urinary retention. Answer number 3, we can eliminate. Why? This medication, as the antiemetic, does not cause diplopia or double vision. That's what diplopia is, double vision. It does not cause dropping of the eyelids. And it does not cause urinary retention. What we could see is blurred vision, not diplopia. So answer number 3 is eliminated. The correct answer is number 2. Tremors, involuntary twitching, and restlessness. Now, remember, I said at the beginning that you have to watch for an adverse effect that you could see on patients that we give prochlorperazine. there is something called extrapyramidal reaction, extrapyramidal effect. When we give this medication, an adverse effect of this medication is an extrapyramidal effect, which includes tremors, involuntary twitching, and restlessness. So answer number 4 is an adverse effect of the medication. That is the correct answer. As you can see, this question, it is different. It is harder. It has a different approach. You cannot analyze all the pharmacology questions the same way. This is why I am sharing with you different styles of questions. But what's going to make you develop the ability to answer NCLEX style questions? Riding the NCLEX bicycle, practicing questions in a Q bank, whichever Q bank that you prefer. Kaplan, UWord, Archer, whichever you feel comfortable using. But you need to be practicing questions every single day. Do you want to practice another question? Or should we be done? Finished for the day? I'm tired already. See, I get very into these questions. I'm sweating here. So if you want to give up, no more questions, we go home. And we come back tomorrow, day 3, which is going to be extremely, extremely important. I will tell you what day 3 is going to be about. But if you want to practice one more question, go ahead and comment in the comment section. Professor, let's do one more. Like the video if you haven't done so, okay? I see a lot of you that haven't liked the video yet. Show me that support. So let's go to the next question. The client who has been prescribed phenytoin for epilepsy calls the clinic and reports a measles-like rash. Wow. What an important question here. What an interesting scenario. Which intervention should the nurse implement? So the first thing that I want you to recognize here is that we are not dealing with a pediatric patient. Okay? For several reasons. Number one, unless it says a pediatric patient, a 5-year-old, an 8-year-old, a 9-year-old, it is always an adult. First reason. Okay? So, first reason why this is an adult. Second reason, this patient called the clinic and reported something. Hey, I have this measles-like rash. I have this rash on my body. So, after the nurse receives this information, what should the nurse implement? Notice that on this question, it doesn't say intended effect or effective. It doesn't say side effect. It doesn't say adverse effect. So the information that I just gave you about intended, side, and adverse effect is hidden in this stem of the question. It's not as obvious. It's not clearly stated. You could see many questions on the NCLEX where this is hidden. It's not clear. But the scenario that they're giving you deals with an adverse effect of phenytoin. But nowhere on the stem of the question it states adverse effect. But also, it is important to know that the patient calls and report a measles-like rash. The words report means there is a change in condition. Okay? In scenarios that deal with change in condition, we usually have to really analyze those scenarios. This is not going to be an easy question. Answer number 1. Instruct the client to come to the clinic immediately. Remember, the adverse effect, I gave you that information, but it's not on the stem of the question. So maybe some of you failed to recognize that this is a scenario dealing with an adverse situation, an adverse effect situation. So let's say that you read the question and you feel a little lost. Measles like rash? Why? Why this rash? And maybe you don't recognize, maybe you didn't read that part of the book. Okay? So answer number 1 says, hey, patient, this is a big problem. Patient, this is an adverse effect. Come to the clinic immediately. So answer number 1 tells me that this is an adverse effect. So AE, the initials that I'm putting here, AE means adverse effect. So keep that in mind. Answer number 2 says, determine if the client is drinking grapefruit juice. Implement. This is an implementation. This is an assessment. We're going to leave that assessment there. Let's not mess with that assessment, because assessment is super important, especially if we're dealing with a phone call. We don't have a lot of information. So let's leave that one there. Answer number 3. Encourage the client to apply a hydrocortisone cream to the rash. So what is the difference between answer 1 and answer 3? Answer 1 says, ding, 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 emergency, come to the clinic immediately. Answer number 3 says, it's okay, just apply some hydrocortisone cream to the rash. So 1 is saying this is an adverse effect, come get treated. Answer number 3 kind of says, oh, this is normal, just apply some hydrocortisone cream. So several things wrong with answer number 3. The first thing that is wrong is that we're giving an advice on medication administration that it is not under our scope of practice, especially if we haven't really assessed the patient, because we are receiving information from the patient that some rash just appeared. But answer number 1 seems to be adverse effect, while answer number 3 seems to be, or the nurse recognizes as a side effect, a common side effect. So answer number 1, the nurse recognized this is an adverse effect, come to the clinic. Answer number 3, the nurse is saying, oh, this is normal, just put some cream. You see the difference? So answer number 1 and 3 are opposite to each other. Answer number 4 says, explain that this is a common side effect of this medication. So what is the relationship between 3 and 4? The same thing. In answer 3 and 4, the nurse got the information and analyzed it as a side effect, a common side effect that does not need emergency medical treatment. While answer number 1, the nurse recognizes that this is an adverse effect and needs emergency medical treatment. So how can we use critical thinking here to select and eliminate answers? Well, there is a strategy that you can use. Answer 3 and 4 are similar. 3 and 4 similar. And answer 1 is opposite. What does the strategy say? In a prioritization question, when it is not a select all that apply, answers that are similar are eliminated and the opposite answer is selected. Not always, but on most cases. So even if you're lacking knowledge here on what these measles-like rash represent, you can use the comparable or alike strategy to eliminate answers and select the correct answer. So using this strategy, the correct answer is 1. But you can say, well, Professor, what do I do with answer number 2? The grapefruit juice question. Because I know that many medications cannot be taken with grapefruit juice because grapefruit juice affects the absorption of medication. Yes, it's true. Grapefruit juice affects the absorption of many medications. But this question is not about a subtherapeutic effect of a medication because grapefruit juice is affecting the absorption. The question is about side effect or adverse effect. So answer number 2 does not make sense, and the correct answer is answer number 1. So what is this measles-like rash? So let's talk a little bit about content. But notice, I started with critical thinking, not content, not knowledge. Why? Because what happens when you're in the NCLEX and a medication or a condition appears and you're lacking knowledge and content in that area? What are you going to do? Just give up? No, you have to fight. You have to analyze that question. You have to use that critical thinking. You have to use strategy. That is why every video I put here is critical thinking, because I want you to improve that. So what is going on with this measles-like rash? This is called a morbilliform rash, okay? A morbilliform rash in a patient that is taking phenytoin or Dilantin, it is an adverse effect of the medication. And when this happens, the patient needs to come to the clinic or the emergency room immediately. Okay? This medication needs to be stopped. It's causing harm to the patient. It is not just a simple rash. This indicates an adverse reaction to a medication. Okay? Important key factor to know, important thing to remember here. This type of rash could be seen in viral, okay, or similar rash could be seen in viral infections, post-viral infections in pediatric patients. But this type of rash, okay, on adults, most commonly and frequently indicates an allergic reaction to a medication. So something important to remember. This is not any just simple type of rash. It's a critical condition. So answer number 1 is the correct one. Who is ready for day 3? Day 3, tomorrow at 5 p.m. You cannot miss it. We're going to talk specifically about cardiovascular medication. So I want to dedicate the time to talk about some of the most common cardiac medications on the NCLEX, important tips as well, and also we're going to practice some questions together and continue improving that critical thinking, that strategy, prioritization, analysis. Once again, for those of you who have not joined our membership, if you're interested in following a mentor, you can join our membership for $9.99 monthly, a reoccurring payment. We try to upload new videos weekly, try to put new information there. There's not a whole lot of videos now. There's maybe like 45 videos now, but quality, good information covering different topics, prioritization, all the prioritization strategies, arterial blood gas, chest tubes, infection control, EKG that I just mentioned earlier, dosage calculation, and a lot of questions that we are providing. that is it, guys, for today's training. I hope that you have found this training beneficial. Once again, if you haven't subscribed, subscribe to our channel, like our videos, and share with other nursing students who are preparing for the NCLEX. God bless you all. Bye-bye. See you tomorrow at 5 p.m. Eastern Standard Time.